Pop quiz number 68. The nurse documents that the client is at risk for falls. What risk factors increase any client's risk for falls? Select all that apply. All right, guys, how do we treat select all that applies? We treat them as true or false. So let's go. 1, the client is male. True. Being of the male gender, you are at a higher risk for falls, and research has shown what happens is males are more likely to take risks and less likely to ask for help. So they're more at risk for falls than females. 2, client has a fever. False. The fever by itself does not put a patient at risk for falls. Now, if the patient has a fever and the fever is high enough to cause delirium, that's something else. If the patient has delirium or they're confused, yes, they'll be at risk. But just having a fever, that doesn't make it a fall risk. 3, client's confused. Well, I just told you the answer. Yes, true. If the patient's confused, that makes them a higher fall risk because the chances are they're not going to press a call light. They're not going to press a button for help to go to the restroom. They'll just try to get up by themselves. Choice 4, client has vertigo. Yep. If they're feeling dizzy or if they feel like the room is spinning, they're more likely to fall. True. How about 5, the client is hearing impaired. False. Having impaired hearing doesn't increase your risk for falls. 6, the client needs help with toileting. True. So if the patient needs help, they're incontinent or they have that feeling of urgency, they may try to get up and just rush to the restroom themselves because they might be scared they might take too long to get help, and that also will put them at risk for falls. So the correct answer is being male, being confused, having vertigo, and also needing help with toileting. All of those increase the risk for falls.